Honorable guests, ladies and gentlemen, good evening, good morning, and of course, good afternoon. And welcome back to the 2022 World Emerging Security Forum. And now we would like to begin the session 2 on health security of the 2022 World Emerging Security Forum under the theme of Lessons Learned from the Pandemic and Prospects for a Global Pandemic Treaty. The health security session will consist of 2 keynote speeches, a panel discussion, and of course, we would like to have a Q&A session at the end of our session. So during the session, those who are joining us online, you could leave any comments or questions in the comment box, and the participants here at the site can send their questions through the QR code that you can find on forum leaflet. So ladies and gentlemen, we would like to ask for your active participation until the very end, and we will try our best to answer your questions. Thank you very much for your kind cooperation. Then with that, we would like to have the keynote speeches. As I mentioned before, we would like to have 2 keynote speeches at this session. The first keynote speech will be delivered by Mr. Tedros Ghebreyesus, Director General of the World Health Organization. Next, we would like to have another keynote speech delivered by Mr. Seth Berkley, CEO of Gavi, the Vaccine Alliance. So they have sent us a very meaningful pre-recorded video. Now, ladies and gentlemen, let's get our attention to the screen with a big round of applause.
Excellencies, esteemed guests, dear colleagues and friends, I thank the Republic of Korea for its leadership in global health security, including through the Act A Facilitation Council, the Group of Friends of the Treaty in Geneva, and the Group of Friends of Solidarity for Global Health Security in New York. I'm also deeply grateful for the Republic of Korea's financial support for COVAX. Hamsamida. More than 6 million lives have now been lost to COVID-19. Countless livelihoods destroyed, and the global economy has been plunged into its deepest recession since the Second World War. Even as we work to end this pandemic, and it's not over yet, we must learn the painful lessons it's teaching us and prepare for future health emergencies. The international health regulations provide a vital legal framework for responding to the global spread of disease. But the pandemic has exposed shortcomings in its application and implementation. In December, WHO member states made the historic decision to negotiate a new international instrument to strengthen pandemic prevention, preparedness, and response. The resulting agreement, I hope, will better define what happens when an outbreak occurs and determine a global policy for equitable production and distribution of countermeasures. COVID-19 has taken so much from us, but it has also given us something, an opportunity to better prepare the world for future health emergencies. We must take that opportunity to build a safer future for all of us. I thank you. Kamsahamnida.
Excellency Park Jin, Foreign Minister of Korea. Excellencies, distinguished delegates, thank you for inviting me here today. This pandemic has taught us so many harsh lessons, but perhaps the most immediate one is that in terms of the potential for loss of life, disruption to society and livelihoods, and impact on economies, outbreaks of infectious disease pose one of the biggest and increasingly most likely threats to the global and economic security. In this context, the World Emerging Security Forum is both timely and pertinent. To start with, let me thank Korea's active participation in COVAX, a global risk-sharing mechanism for pooled procurement and equitable distribution of COVID-19 vaccines as part of the ACT Accelerator. Korea is one of the major contributors to COVAX, in particular to the Gavi COVAX Advanced Market Commitment, focusing on vaccine equity for lower-income countries. Korea's leadership and support have helped COVAX to protect hundreds of millions of the most vulnerable people from COVID and ensure that we are ready for future pandemic shocks. So far, COVAX has delivered over 1.5 billion doses of vaccine. The vast majority, more than 1.35 billion, have gone to people living in the 92 lower income countries that otherwise would have struggled to get them. However, despite huge progress, with an average coverage of 48% with 2 doses in these countries as compared to a global average of around 60%, many countries, 17 at the last count, have still yet to protect 10% of their population with 2 doses. These are often fragile countries, and it's difficult to reach. So we have to think about this as not being just the last people to be reached, some of the hardest to reach, and in terms of future pandemic preparedness, one of our biggest blind spots. That is why COVAX is accelerating its country-centric approach to supporting countries with low coverage. Thanks to the ongoing support of the international community, including the Korean government, in April at the Gavi COVAX AMC Summit and at the COVID-19 Global Summit convened by the United States in May, we've made important progress towards not only ending the pandemic, but preparing for the next one too. And we are encouraged by the continuing commitments made by the global community. In this context, we do recognize the need for a global instrument to prepare and respond to future pandemics and are supportive and engaged in the intergovernmental negotiating body process to develop a pandemic treaty. What we can contribute to today's discussion are the lessons learned and the experiences we can share from COVAX and more broadly with Gavi's engagement in fighting outbreaks such as Ebola, yellow fever, meningitis, and cholera routinely. Lessons from the current pandemic underscore the need to put equity and global solidarity at the center in any efforts to strengthen future pandemic preparedness and response. Because if we're not prepared to protect everyone, then we're not really prepared at all. Based on our 20-year-plus experience in advancing vaccine equity, Gavi would like to offer 4 suggestions toward the substantive elements of a new international instrument. First, we have to ensure rapid and agile contingency financing, such as through innovative financing mechanisms. This should support surge capacity and enable existing networks of global health agencies to orchestrate a rapid pivot when needed and mount a rapid and robust global response during a crisis. Second, we need to maintain the key and rapidly scalable innovations from COVAX, such as adapted regulatory frameworks, fair allocation mechanisms, as well as the necessary compensation, liability, and indemnification legal safety nets. Third, we have to diversify and expand manufacturing capacity in emerging economies so as to increase global vaccine supply security, including for pandemic vaccines when the need arises, whilst managing its impact on routine immunization. And fourth, we need to strengthen investments in routine immunizations and resilient primary health care with a focus on health system access for the most marginalized communities who are most at risk from outbreaks due to gender, geographic, and socioeconomic barriers. Whatever form future pandemic preparedness takes, we need to make sure that it does not create duplication or added layers of process that could slow down the response of the existing agencies. It also needs to build on and learn from COVAX's record, not just in making vaccines available to everyone, but in fostering the kind of global multilateralism that is needed to end a pandemic. The same level of global collaboration will be needed to prevent the next one. For these reasons, we need to be wary of reinventing the wheel. We look forward to working with you to create healthier, safer, and a more equitable world. Thank you.
Thank you so much. Let's give them a big round of applause, ladies and gentlemen. Thank you so much. Now we will commence the panel discussion. Today, we are joined by Mr. Tarun Saluja, Head of Clinical Development at International Vaccine Institute. He will lead the session today, standing in for Dr. Anne Wurtel, who cannot join us today for health reasons. So please come up to the stage. And we're also joined by Mr. Ahmed Ogwell Oma, Acting Director of the Africa Centers for Disease Control and Prevention. Please come up to the stage. Next, Mr. Yan Zhong Huang, a Senior Fellow for Global Health at the Council on Foreign Relations, are joining us today. Please come up to the stage. And last but not least, Ms. Baek Kyung-lan, Commissioner of Korea Disease Control and Prevention Agency, is also joining us today. Ladies and gentlemen, let's welcome our panelists onto the stage with a big round of applause. With that, I would like to pass the microphone over to Mr. Salusa. The floor is yours.
Thank you. So good evening. First of all, I would like to thank Ministry of Foreign Affairs for hosting this very timely and extremely important session on health security. And it's my pleasure and indeed privilege to moderate this session with world-renowned experts in the field. So I look forward to very productive conversation. So to start with, as we know, 2 years after the World Health Organization declared the outbreak of COVID-19 in January 2020 as a public health emergency of international concern, the world is still facing variant and cases of reinfection amid growing expectation of a possible transition from a pandemic to an endemic. Moreover, given the history and increasing frequency of health crises, it is anticipated that outbreaks of new transmittable diseases will occur periodically, requiring system-wide preparation on the part of the international public health architecture. Several problems and limitations that appeared in the global community's response to COVID-19 has led to increasing demand for the improvement of the global health security governance. These problems include inadequate sharing of information in the early stages, lack of readiness and resilience, shortcoming in public understanding and awareness, and despite the impressively fast development of effective vaccines, problem of inequity in their distribution and availability. From identification and early response during the initial stage of the outbreak to vaccine distribution, there is a consensus among nations on the need to strengthen global public health governance. And thus, negotiations have started in World Health Organization on the Global Pandemic Treaty. Based on lessons learned from the response to COVID-19, there is a growing recognition that Global Pandemic Treaty should include measures to improve global governance. In this regard, the Independent Panel for Pandemic Preparedness and Response recommendation to focus on improving rapid, flexible, and preventive responses in preparation for recurring and unexpected health security crises should be considered. In addition, it is necessary to enhance international cooperation in research and information to strengthen scientific evidence, which requires the cooperation of private sector with technologies for the development and production of vaccine and medicines. With this background, I would like to pose 4 questions to our esteemed panelists. The first question is, compared to past pandemic, what are the new global health governance related lessons learned from COVID-19? Second, what must be included in Global Pandemic Treaty to make up for the limitations of global governance seen in response to past health crises, including COVID-19? Third, the international community has realized the importance of research cooperation and information sharing, capacity building for developing countries, and participation of private sector in fight against COVID-19. Based upon past experiences, how can international community engage the private sector in negotiation on the Global Pandemic Treaty? And the last one, are there measures that can be agreed between governments outside the scope of the GPT to minimize and manage the economic and social consequences of a future pandemic so as to limit the social destabilization that often ensues from the pandemic? So let me start with Dr. Baek Kyung-lan, Commissioner, Korea Disease Control and Preventing Agency. Over to you, ma'am.
안녕하세요. 네, 안녕하세요. 백경란입니다.
Good afternoon, good evening. This is Baek Kyung-ran. Now, first of all, it is a great honor for me to be attending this World Emerging Security Forum. Yes, indeed, for the past 2 years, the world has been suffering from the COVID-19 pandemic, and it is not over. And now, we are now seeing the emergence of the monkeypox. And even today in Korea, now we also have had 2 cases coming into Korea just today. Now, the WHO, according to the IHR, is now reviewing whether the monkeypox is corresponding to the public health emergency of international concern or not. So they will be holding a meeting tomorrow to make this decision. And Korea is also very carefully scrutinizing the current situation. So now, regarding the vaccine, now we were able to develop the vaccine for pox and were able to declare the end of it. And we were also able to develop many other vaccines, but still, the SARS for the new influenza, Zika virus, and the COVID-19, and now with the monkeypox. Now, they show that the humanity is still under the influence of recurring pandemic or infectious diseases. Now then, we need to look back to our experience of COVID-19 in responding to this pandemic so that we will be able to learn important lessons to prepare better for the future. Now, under the WTO, there was the independent panel and then also the IHR review committee and also the IPPR review report. And it is through these processes that they have looked back to the response to COVID-19 and also to shed light on the additional preparation that we need to make for the future. And as has been observed already several times, now the COVID-19 response centered on the WHO so far. So some of the limitations that we were able to identify is the need to have broader information sharing rapidly and also to make sure that we are able to make the prediction about the spread of the infectious diseases early on, and also to make sure that we have the equitable allocation of the resources, including the masks and other protective equipment across the globe. So these were some of the things that we need to improve on based on the lessons learned so far. Now, I have also been part of the response committee in Korea, and I was also able to experience some of these limitations as well. Now, for the COVID-19 and also especially for the vaccines that have been newly developed, there was lack of information in the beginning, and also in the beginning of the vaccine availability, there were also some supply issues. So because of the supply shortage, we also had to think long and hard about how we are going to overcome the challenge. So I still remember vividly the experience that we had. And it was not limited to Korea, it was also the same in other countries, and also for some other governments or countries that had lesser financial resources, and also the countries that had lesser access to vaccines. I'm sure that they had even bigger suffering. So now these unfortunate situation, so this also calls for a collective effort for us to build up capacity across the globe, because that is something that we did not have during the early stages of COVID especially. And also we did not have the kind of system that would encompass both the public and the private sector in responding against the pandemic. So what we need is to look into the shortage of the necessary resources and the supplies, and to come up with ways to make sure that we will be able to have adequate supply. And again, we did not have this capacity, especially in the early days of COVID-19. Now, as Dr. Berkeley has mentioned, COVID-19 has shown that infectious diseases know no borders, and no one is safe until everyone is safe. And for us to respond to this type of global infectious disease also requires global cooperation, because it is something that goes beyond an individual country's capacity. And this also means that we need to strengthen multilateral cooperation and coordination. between the low-income countries, high-income countries, between civil society and the private sector. So actors in different sectors have to come together to work together. We also need to have the kind of governance to put them together and coordinate the different interests. And to make this possible, there is a proposal about a global pandemic treaty, and there is discussion underway on what would be the measures that would be effective in preventing or dealing with future pandemic. So this discussion is underway between the governments, and also there's discussion underway about what has to go into the global pandemic treaty, and I would like to make 5 suggestions related to that. The first is, so I believe that we need to come up with the solutions that would help us overcome the limitations that we have experienced in the early days of COVID-19. We need to make sure that there would be cooperation from and between governments to make sure that we will create the kind of environment that would make us be able to respond to the infectious diseases. So for example, the diagnostic systems or the different supplies that we need. So we need to come up with the kind of system for each region to build this system at an early day. Second, in order to implement these actions, we also need to come up with the necessary financial resources. Now, in order to make up for the limitations in the pandemic response, we need to have a periodic health status review, and the WHO should be able to provide periodic support to the vulnerable countries, and it is also this that has to be included in the pandemic treaty. And third, not only for the public sector or the government, but we also need to come up with ways to open up participation, and especially for the private sector, for them to take the initiative in this. As you would know, the vaccine for COVID-19 was able to be developed at a very rapid period thanks to the long-standing development by the private sector in the mRNA sector, and also thanks to the civil society that had been providing support for this. So this means that the private sector will be able to, and they have been playing an important role in filling the gap in the healthcare sector that has been left by the government. Now, for the Act A that has supported the supply of necessary items and vaccine for COVID-19. Now, this is also a good example of a public-private partnership that has participation by not only the government but also other private groups like CEPI. And I understand that there is going to be an opportunity to broaden the participation by the private sector as we continue to have this discussion. And fourth is, now we see that many of the diseases like the monkeypox are transmitted between animals and humans. So given this, and also given the fact that these diseases can also become pandemic, we also need to include this provision in the global pandemic treaty as well. And last but not least, in order to create and generate the data that is generated during the pandemic, we also need to build the database to a global database to build and store this type of data. And we also need to work together to foster the necessary human resources in this field. Now, for Korea, we are planning to provide support to the low and middle income countries to enhance their vaccine development capability by working together with the WHO. And we will also continue to encourage private sector participation in this field as well. Now, given the time today, I believe that it is ripe for us to come up with alternative means to globally deal against pandemic. as we continue our discussion for the Global Pandemic Treaty. Korea will also actively participate in the Global Pandemic Treaty discussion and will continue to be an active participant in trying to promote the global healthcare system throughout the world. And Korea has also hosted a related, so we are planning to host a related meeting in this to have high-level ministerial talk about the global health security. So we will continue to play an active role in enhancing the global healthcare security and governance throughout the world. Thank you.
Thanks a lot, Dr. Kyung, for sharing your experience of Korea and contribution of Korea toward capacity building for low and middle income countries. Now I would turn to Dr. Yang Hong Huang, Senior Fellow for Global Health Council on Foreign Relations for his views, please.
Thank you. And also thanks to Korean Minister of Foreign Affairs to invite me over to attend this important forum. And it's a great opportunity to meet a stellar group of experts and practitioners in the field. So for the first question on the lessons learned, right, and also in terms of what makes this pandemic different from previous ones, I can only highlight maybe two important developments. The first is what I call the politicization, right? That is when the world is responding to the pandemic at both the national and the global level, we are framing it as at international level, a competition between democracies and authoritarian countries. That, in a way, poisoned, as Dr. Smith pointed out in the previous session, this atmosphere for international cooperation, right? Let me give you the example, right? We know that China, for example, represents one of the biggest risk factors in responding and preparing for pandemics. But this politicization, framing the pandemic response as a competition between two political systems, literally means that Western countries, when they're preparing for the next pandemic, actually excluding China from the conversation, right, on pandemic preparation. That is unfortunate. It is also incoherent because, again, we know, right, dealing with a global challenge, we need a global solution. You cannot just exclude any country, not to mention a country that has so much leverage and size like China. Right? And secondly, that's in terms of politicization, again, this is the first time, right, that ideology has entered, right? The global response to a pandemic. That means when we're talking about, right, this origins probe that is investigating the origins of the pandemic, because of these political factors, political stakes so high, it makes it very difficult, right, for countries like China to be fully cooperative, right, in the pandemic probe. That is explained why after more than 2.5 years, we still have no clue where this pandemic is from. How did it start? Right? This is rather unfortunate. It's very different from the previous ones, where we, even for an epidemic like SARS, right, after 13 years, we still were able to identify the etiological agent of the epidemic. And the second problem also that is different from the previous pandemics, that this is the first time we are seeing, right, this pandemic is being framed as a national or international security by so many countries. So when we're talking about securitization, essentially means we frame the issue as an existential threat that requires emergency, extraordinary response, from the states. That leads to what we consider by the containment-based approach, try to contain the spread of the virus. But as we later found, right, because that virus is so transmissible, right, so contagious, it is very difficult, right, to contain its spread, not to mention to eliminate, right, the virus. So how to make, complete that shift from securitization and desecuritization when by the landscape of the virus spread has changed. I think that is also a challenge we have to deal with. We're seeing by some countries like China continue to stick with that zero COVID strategy, right? That instead of shifting to a mitigation-based approach that focuses on severe, reducing severe cases and death. So I think securitization presents another challenge, to the global society. And the second question is the pandemic treaty. How what provisions should be included in terms of global governance. I think the new pandemic treaty, which we expected that it's going to be under negotiation in the coming years, will have to address the issue of inequality and adopt a rights-based approach, right, in dealing with the governance issues as far as the pandemic preparation is concerned, because as Dr. Sesbersley talked about, right, this is not acceptable, right, in terms of vaccine distribution, right? It's not that we don't have enough vaccines. We have enough vaccine. Now we even have an oversupply of vaccines, just including by the Western countries, right, and Chinese vaccines. It's like more than 11 billion doses, right, annual manufacturing capacity. Right? The problem is how to get the vaccines distributed in an equal and effective and efficient manner. Right? The second problem is the issue of sovereignty. Right? Again, in terms of the distribution of the vaccines and the therapeutic means, right? That initially, we had that problem of vaccine nationalism. High-income countries stockpile the vaccines for their own population, right, to the detriment of low-income countries. Right? We know that for low-income countries, even today, I think until last month, right, only 11% of the population there, right, have been vaccinated with 2 doses. So the sovereignty is a challenge also to global governance, and the third challenge is just to come to me this morning. I think this pandemic treaty needs to have the articles that deal with the multiple crises associated with the pandemic, right? So by multiple crises, I'm talking about the pandemic itself is a crisis multiplier, right? Exacerbated the food security crisis, exacerbated the supply chain problem. But in the meantime, I think the pandemic treaty should also consider, right, how they can devise institutions and norms to handle contingency developments, right? Like, this Russia invasion of Ukraine. We have never thought of that is going to happen during the pandemic, but we do know, right, that this invasion sucked the oxygen, right, from the global pandemic response, now in terms of funding, in terms of the commitment. So, that presents another problem for pandemic preparedness and planning. The third question about how the role of the private sector in research cooperation and information sharing, right? If we agree that better preparation for the pandemic needs early detection and rapid response, right? Then I think private sector can play a very significant role here, right? The first, we need the private sector to help, right? To do better surveillance and monitoring of new variants and new pathogens. Government labs could be very important, right, to do the job. But in the meantime, we know that the governments, right, because of the concerns about, the economy, about social political stability, they have the tendency to downplay, right, the seriousness of the crisis, especially in the beginning stage of the crisis. So the private sector, including, right, the private labs, that they could play an important role in disease surveillance. I was just having a conversation with the head of the pandemic preparedness defense coalition, who's worked at Abbott. I was told that Abbott, which is a pharmaceutical firm in the U.S., they have been on this, doing this global surveillance, right, since 1984. So the private sector could indeed be immobilized to do effective disease surveillance, but they could, of course, play a much bigger role in the second the aspect, that is early development and rapid deployment of scalable and quality, right, diagnostic tools, vaccines, and therapeutic means, right, targeting the new pathogens that have pandemic potential, right? So I don't need to belabor how important, right, these institutions, the private sector is, right? The Moderna, right? The Pfizer, this is so important, right, in helping, right, developing effective vaccines, right, and therapeutic means in responding to the pandemic. And finally, the issue of how to mitigate and minimize the impacts of the pandemic. I think that's also a very important issue, because here, when we talk about pandemic response, I sensed this certain detachment here. That is, our focus tends to be on the direct impact of the pandemic, on the infections, the cases, the number of deaths, the mortality, right? But I think more attention, at least equal attention should be paid to the social economic impacts of the crises. We talk about how to coordinate international travel, right? How to make our supply chain more resilient, right? To avoid this disruption caused by the pandemic, and also the issue of disinformation and misinformation, associated with the pandemic, what WHO consider the infodemics. These are all the impacts of the pandemic. But I think norms and institutions should be developed to deal with these challenges as well, I think. Thank you.
Thank you very much, Dr. Huang. Thanks for your insightful comments, and very beautifully you touched how the global solution should be proposed for the global threat. Vaccine equity, vaccine nationalism should be avoided, and other geopolitical crises do have impact on the pandemic as well, and the role of the private institution, how can they play a big role in surveillance and diagnostics. And of course, impact of the issue, other impacts like socio-economical, political and security crises. Thank you so much for your views. Now I would request Dr. Ahmed Ogwell Oma, Acting Director, Africa CDC, to share his comment, please.
Thank you. Thank you very much. And I would like to thank the Ministry of Foreign Affairs of the Republic of Korea for inviting Africa CDC to participate in this second edition of the World Emerging Security Forum. Very timely, particularly now during this pandemic, and as other health security issues become more evident. Let me start with the lessons that we've learned in Africa. Very sadly, the first lesson we learned is that when there is a global crisis, Africa is literally on its own. It's not a bad thing, by the way, to be on your own, but that's a sad reality that when there is a global crisis, we are on our own. And we unfortunately had to learn that in the middle of a pandemic. Part of the reason for that lesson is another lesson, that global multilateralism doesn't really work very well in a crisis. It works when the crisis is in one corner of the world, but it doesn't work very well when the crisis is global in nature. All the multilateral instruments that were put in place to be able to address emergencies like the COVID pandemic have one after the other systematically failed the continent of Africa. The last was a few days ago when the WTO Council met and passed a resolution that, for all intents and purposes, did not respond to the reason why the TRIPS flexibilities were negotiated over many painful years, and the reason why that kind of instrument was put in place in the WTO environment. These instruments of multilateralism have not worked for us on the continent. The third lesson we learned was a much happier lesson, and that is that African solidarity comes through when we are left on our own and when the multilateral instruments are not functioning well for us. The solidarity on the continent came through. To date, the heads of states of the African region have met 23 times at least to discuss various crises. The COVID pandemic has been at the core of those conversations, provide guidance and leadership when the global leadership was challenged. That solidarity was not only at the heads of states level, but it also was evident amongst our ministers and amongst our technical cadre, whether it was at the leadership level or whether it was in the field, indeed even the public. That solidarity came through, and it succeeded in the low numbers that we've seen in Africa. In the beginning of this pandemic, there were predictions of huge numbers of deaths. I think the models didn't take into consideration African solidarity. And the numbers have remained low, and we are trying our very best to keep them low. The fourth lesson we learned is when we become innovative, then we break down the challenges of access to countermeasures, particularly. We established the Africa Medical Supplies Platform when it was very difficult to get even test kits in the beginning. PPEs were next to impossible to come across. I'll not speak about vaccines at the moment, but those not only came late, they came very late. But by being innovative and providing ourselves with avenues of accessing these countermeasures and the tools we needed to handle the pandemic, we succeeded. The Africa Medical Supplies Platform was a very important conduit of countermeasures for many countries on the continent when purchasing on the open market became literally impossible. The Africa Vaccines Acquisition Task Team, now Africa Vaccines Acquisition Trust, was the vehicle that came through when the COVAX facility found it a challenge to be able to provide vaccines to the continent because their supply could not be able to deliver for Africa. We became innovative in many ways, including the way the ways in which we handle the pandemic at country level. We used our community health workers instead of technology that many parts of the world were using. We repurposed our health workers, including those who are about to graduate, so that we had enough knowledgeable people on the ground to be able to handle public expectations, the number of those who required clinical management, indeed those who were hospitalized, even those who passed away, and we needed to engage them at the mental health level. It worked because we became innovative. The fifth lesson we learned is health security is an ongoing activity. You don't do it because of the pandemic and then you stop. It has to continue throughout. And that is why, as Africa, we have decided that it's only under a new public health order that we can be able to address issues of health security, not just on the continent, we believe globally as well. We can't go on doing things as they were being done before, because those former plans, structures, global architecture are not working the way they were supposed to be working. Sixth, and in fact, it's a good example now that we have monkeypox being considered as a public health emergency of international concern. We've had monkeypox on the continent since 1970. During this pandemic, we've had over 10,500 cases. We have sought vaccines to be able to protect our frontline health workers. It has not yet met the criteria for a public health emergency of international concern. 10,500 cases plus, over 460 deaths, and still it doesn't meet the criteria. Now that cases are being found elsewhere in the world, there's conversation that now we can look at monkeypox as a public health emergency of international concern. That instrument too has failed when it comes to an African situation when we are talking about monkeypox. We can't do things the same, otherwise we will not get different results. On the issue of the pandemic treaty, the way we approach this discussion of the pandemic treaty is to look at the current instruments. Are they working or are they not working? And if they are not working, I mean, if you wanted to cross the city of Seoul and it takes you 3-4 hours to do that, you don't look for another vehicle to cross the city faster. You have to look for a different kind of instrument and a different kind of vehicle to shorten that journey. You don't use the same vehicle, however more beautiful it may be. It will not take you less time because you'll be using the same infrastructure. A new global legal instrument. What will it do if the current legal global instruments are failing? At least for us in Africa, they are. So when we look at that discussion, we reflect on our lessons, and there are a few things that we feel must be accommodated in any new legal instrument. The first is rapid sharing of information. If we don't share information rapidly, and I think IHR has been very clear that there are huge gaps there in as far as information sharing is concerned. If we don't address that, the new legal instruments will still not work. Second is the immediate availability of countermeasures as a public good. We've all said that if one part is not safe, the rest of the world is not safe. If countermeasures are not made available quickly, efficiently, and immediately within this new global pandemic treaty, it will not work. Third is speed. Whatever has been agreed, the instrument must accommodate the need for speed. If it is not speedy, then it will not work. 2 years down the line, we are still considering whether monkeypox is a public health emergency of international concern or not, yet Africa has lost 460 people. Over 10,000 have been diagnosed with this particular illness. If there is no speed, it will not work. Finally, is that treaty must, and this is a minimum for us in Africa, it must accommodate regional action. At the regional level, we must be able to declare a public health emergency, and we must be able to take action at the regional level. We don't have to wait for 2 years for consideration of a public health emergency if it is affecting the continent, if it's affecting a particular region of the world. If regional action is not accommodated in the treaty, it will not work. Finally, the last two questions, I'll bundle them together because they're very related. The private sector is part of us. We are the private sector. Without us, there will be no private sector. We are the market. And that's another lesson we've learned, that private sector must address issues of health security, because without health security, there'll be no or very little trade. There'll be very little economic activities. So their activities will also not be able to thrive. The enterprises will not be able to grow. So the private sector must be part of the public discussion that we are talking about. And although governments have the responsibility of incentivizing the private sector to be able to address a public good, it is in the interest of the private sector that health security is good, that disease threats have been secured quickly so that you can be able to go on with your economic activities. So the private sector should not be thinking only of profits. The bigger incentive is that there is a market for them to be able to trade in tomorrow. In this way, research and development of different countermeasures that we require, availing those tools to the public so they can be able to be used rapidly, is absolutely critical. And private sector should not be looked at as different from public, because we are all part of the same community. Finally, let me emphasize that health security, in our view, is actually national security. And national security is what will translate into global security. If there is a break in health security, there will be a break in national security and therefore global security. And there is no way that we are able to disinvest in health security if we want to remain secure at national and global levels. From Africa, we are convinced that the only way for us to be able to achieve health security and therefore national and global security is to implement what we are calling the new public health order, where each region must be able to take care of its own priorities in a fast and efficient way, and all countermeasures that are required, all tools that are required to be able to prepare and respond are made available efficiently, quickly, and equitably. Thank you.
Thank you, Dr. Ahmed, for the holistic overview of the problem and suggesting for potential solution, and especially highlighting when it comes to inequity, and that too in African subcontinent. We all agree that be it public, private, state, non-state actor, each one have their own strength and weaknesses. Maybe it's time to leverage each other's strength, complement each other, and come up with the global solution. Maybe now I will move to the next round of questions. So the first question to all panelists is, when we talk about lessons learned, we have seen that even the developed countries struggle to combat the pandemic despite very high ranking on Global Health Security Index. And when it comes to developing countries, it's much more complicated due to limited capacity in terms of infrastructures, training. So do you see technology playing pivotal role in bridging the capacity gap? So what is the role of each stakeholder here? So maybe I would request Dr. Kyungdon to start with.
너무 어려운 질문을 하신 것 같습니다.
Well, that was such a tough question. So, of course, in order to overcome those issues and challenges, of course, that we would have to work hard. But then, and of course, in trying to overcome the pandemic, I do believe that the technology in this case did make a big contribution. And even before it became a pandemic. Now, I believe that we need to focus more on the pandemic preparedness.
께서도 말씀을 하셨는데
Now, Dr. Oma also mentioned that, of course, at the regional level, so a regional issue, regional problem could escalate into a global problem. So we also have to focus more on providing support to the different regions. So we need to have the kind of global mechanism to provide regional support. So for example, the vaccine or the diagnostic kits that we developed, I believe that those were also based on the efforts that have been built up so far. So what we need to do is share the technology and also try to help other countries so that other countries can also build up their infrastructure. Perhaps they can also import the effective infrastructure from other countries. In other words, we need to help each other out.
Thank you very much. So, Dr. Huang, would you like to add? Yes, please.
Sure, yeah. I agree with Dr. Pak that technology does play a very important role in the pandemic response. We are actually seeing this may be also something that is different from the previous pandemics and epidemics, is that we are seeing how, right, that we can develop effective vaccine in such a short period of time, right? Because initially, when we talk about vaccine development, it takes, right, at least like 2 years, right, to develop an effective vaccine. But this time, just like a month, for us to develop an effective mRNA vaccine, right, to tackle the crises, which I believe saved millions of lives. But in the meantime, I want to point out technology, right? It cannot. But this is what we call the technological medical model, right? In terms of the approaches to global governance, right? It is not the final solution to the problem, because let's again talk about this vaccine development. It's precisely why this technology is so sophisticated, right? So efficient, right, in developing the vaccine, that also encouraged, right, this vaccine skepticism, right? People refuse to get vaccinated because they say, oh, this vaccine is developed so quickly, right? Because it used to take 2 years, now only like 5-6 months. There must be something wrong with the vaccine, right? So this issue of misinformation, disinformation, actually can be highlighted by the technological development, that should be, again, that addressed, as a governance challenge. In the meantime, I want to point it out, there are other, right, the issues, but that not necessarily, right, related to technology that I think are equally important, right? You mentioned this, like developed countries, even though they were ranked high in the Global Health Security Index, but they failed, right, miserably, right, in responding to this pandemic. So there are issues of public messaging, there are issues of complacency, there are issues of health system, capacity that are all built into this process. We are now talking about reforming the U.S. CDC to make it more efficient and effective in responding to health crises in the future. So this cannot be addressed by technology alone, of course.
Thank you very much. So, Dr. Oma, I have a leading question with that. So, as he said that there was a lot of misinformation, but we say that there was wrong use of technology, let's say social media, there was mistrust among the community. So we have seen, particularly in African countries, even if vaccines were available, there was or still there is very low uptake, and the coverage in few countries in Africa is even less than 10%. So how could we build the trust among communities and ensure their voices are heard and concerns are addressed? Over to you.
Yeah, thank you. And allow me to, the first very provocative question, I would like to touch on that a bit and link it into the second one. And I say provocative because the Global Health Security Index has given very high rating for some countries that have got huge challenges with a global health security issue like the pandemic. So in my view, and this is personal, it's not Africa CDC, is we need to look at the Global Health Security Index again. It's giving us the wrong figures, and the pandemic has shown that it needs to be reformed. It is one of those that when it is reformed, then we can be able to get a better balance of what a country's actual rating should be. When you link that to technology, for me, technology needs to make things simpler. If technology is making things more complicated, it is not useful. If technology is not addressing the immediate challenges, it is not useful. So there is space for technology, but only when it makes things simpler. Low uptake in Africa, that is true. The important thing is to address why there's low uptake of COVID-19 vaccines on the continent. And three things stand out. One is the vaccines arrived very late. And like all of you know, when you stay hungry for a very long time, however beautiful the meal comes, if you've been there hungry for so long, it's no longer as interesting as it was. Maybe you figure out a way of not feeling so hungry after a while. And this is what has happened on the continent. Vaccines came late, and then they came in huge numbers that did not make, frankly, any sense to a system that had already been starved of the vaccines. The public started wondering, do we really need the vaccines? Not that they don't want vaccines, but if it has come so late and they are seeing the numbers are sort of under control, it becomes a very big, so this is one thing, the lateness of the vaccines arriving. Second is the system for adult vaccination on the continent. Most of the vaccination being done on the continent is to children, not to adults. African adults, most of them, they go out to earn on a daily basis. If you don't go out to earn, you will not be able to eat. So when I wake up, I have the choice of either I queue up to get my vaccine and I miss my daily income, or I go and I look for my daily income. The choice is a no-brainer. The vast majority will go out and look for their daily income. And where we have gone and taken vaccination to where the public are, in the markets, in the religious places, in the schools, they actually are taking the vaccine. So it is not classical hesitation. It is just prioritization in terms of the timing of the vaccines actually being available. And finally is the infrastructure that is in place to be able to push out the vaccines to adults has not matured yet on the continent. And most of our systems on the continent are so health facility based, and the health facilities are few. If I am a farmer somewhere and I have to take transport for an hour, pay $1 there and back, and I'm earning the $1 for the day, it's not a very good option for me to be able to travel and then spend all my income for the day on transportation to go and get vaccines. So that model for adult vaccination is not yet developed in that way. And these are the three things that stand out why there's low uptake on the continent. But that is going to change because we are designing new methodologies of getting vaccines to members of the public. But for me, the Global Health Security Index needs to be reformed. Thank you.
Thank you very much, Dr. Ahmed. And very beautifully, you pointed out that it's not a question of priority rather than it's a question of priority rather than of hesitancy when it comes to the low vaccine uptake. If there are any questions from the audience, we will be happy to take. Meanwhile, I would like to have a question with Dr. Kyung again. So Dr. Kyung, we know that the re-emerging virus, now like monkeypox, is expanding in many countries. Given that it will take time to reach an agreement on global pandemic treaty, which measure should be taken by all stakeholders, including the governments in their places in the short term? So what do you see, what should be the short-term solution?
Well, as the moderator has just mentioned, yes, the global pandemic treaty with involvement by many different countries is bound to take some time because of the nature of the discussion. So then what we need is perhaps a smaller scale agreement among the smaller number of countries or at a region to strengthen the pandemic readiness in the region. So for example, it was mentioned earlier by Dr. Oma how the African solidarity was very effective and successful. Now, right now in Asia, so building early warning system and also to having a stockpile of emergency medical supplies. So there are discussions starting to be ready for a future pandemic. And also through such regional support architecture, each country can strengthen their commitment to abide by the standards in preparing against pandemic. And based on that, we can also find further ways of helping out each other. So I believe that that could also be one way of preparing against the pandemic in the future. For example, having joint training or joint exercises or joint training for the human resources of the different countries. Perhaps if we can build such human resources, it can also be helpful in having collective response against pandemic.
Thank you very much. So Dr. Huang, would you like to add?
Sure. I think, well, given that it takes years to complete the negotiations for the pandemic treaty, and of course, we can't wait until the pandemic, the treaty is negotiated to start the response to the monkeypox. And I think about, I'm not an epidemiologist, but I think in order to have an effective response, we need to first have a clear idea, right, what the epidemiological characteristics of the disease, right? We know that is a disease that is not going to spread so easily because it's spread through close contact, and it's also confined to a certain segment of the population. So, first we need to evaluate whether that disease has indeed the potential for pandemic spread. And secondly, I think it is very important to build the global networks, cooperating, international cooperation to closely track the disease spread. So effective global surveillance would be very important, right, to get a clear idea, right, the trajectory of the virus, of the disease, its ability, right, to evolve, right, in and the potential to develop into a more dangerous, pathogen. And so it is at this moment, I think effective global surveillance would be the key.
Thank you very much. So Dr. Oma, what could be the immediate solution or short-term solution?
Regionalize emergency preparedness and response. Regionalize emergency preparedness and response. And let me add here that it's only yesterday that today early morning, Korea time, that our health ministers adopted the recommendation that going forward, Africa is going to be able to make its own public health emergency pronouncements, and using that, then we can be able to mobilize and respond. If you don't regionalize it, the global negotiations, as we argue about where the comma should be and the full stop should end, will take months. And we don't have months. Another virus is going to hit us very soon. So regionalize emergency preparedness and response, and let neighbors take care of each other as the globe continues the negotiation. And it is very important to negotiate at the global level, but the speed at which we need to act, we need to regionalize emergency preparedness and response.
Thank you very much. So what you are essentially saying is the local capacity building should be prioritized. Thank you very much. So if there are no questions from the floor, maybe, okay. Let me ask the last question to Dr. Uma itself. So as we know, pandemic adversely affect all the lives on the planet. So what are your thoughts on the need for a stronger international health framework when it comes to One Health approach that is connecting the health of humans, animals, and our planet? Over to you.
No, thank you. This is essential for the global architecture, for the regional architecture, for the national architecture. It is essential at the community level as well. If we don't approach this from a One Health perspective, we will not be able to cover all the gaps that we need. One Health approach is essential to whichever new architecture we are developing, national, regional, or global.
Perfect. Thank you very much. So I think the message is very clear from the panelists that there is an urgent need to strengthen national, regional, and global capacities and resilience to future pandemic. And we do hope that the global health governance through Global Pandemic Treaty will ensure that benefit of the preventive and response intervention like vaccine will be realized by rich and poor alike. Thank you very much for the interesting session. Thank you. Over to you, Jessica.
Thank you so much. Ladies and gentlemen, let's give them another big round of applause. Thank you so much. And ladies and gentlemen, this concludes the session 2 on health security. And we will have the last session, session 3, Emerging Technologies and Security, under the theme of Future of Global Governance on Emerging Technologies from 8:10 p.m. Korean Standard Time. So ladies and gentlemen, please enjoy a short break and please come back at 8:10 p.m. Korean Standard Time. Thank you very much.